You're listening to the Monday Night Community Show with Daniel on BRFM.
This is the Daniel Monday Night Community Show on demand through YouTube. Thank you very much for choosing to listen to us through this method. If you'd like to keep up to date with when I add new interviews, then subscribe to this channel. And we're now going to be talking to a selection of people this evening. It's all part of the regular slot I do with the Swale Clinical Commissioning Group. We're firstly going to be speaking to Rebecca, but before that, just a little bit of an introduction to introduce you to the sort of area we're going to be covering. And John's given me this little introduction. It's February, and of course there's still a nip in the air, and when it gets cold, many people with breathing difficulties such as asthma and chronic COPD end up as emergencies in A&E. We're going to be finding out a bit more about this. So Rebecca, firstly, thank you very much for joining us this evening.
Thank you. Well, good evening everybody, and I'd like to start out by telling you all about COPD and asthma. Yeah. So could you tell us a bit more about that then? Well, coughing and wheezing in winter is normal, but for those already suffering from breathing difficulties, the drop in temperature can be deadly. Swale has one of the highest percentages of extra winter deaths in England, 29% compared with an average of 19%, so that's a huge difference. Many of those are associated with COPD, which includes lung diseases like chronic bronchitis, emphysema and chronic obstructive airways disease, otherwise known as COPD, or you may have been told COPED if you're one of the sufferers. Asthma alone is responsible for more than 1,000 deaths a year in the UK, so that's quite scary as well, 90% of which could be prevented, according to a 2011 government report. So that's really good news there, that 90%, up to 90% could be prevented if some of the correct advice is followed. So people with COPD have difficulty breathing mainly because of the narrowing of their airways. Typical symptoms include frequent chest infections, breathlessness, and a persistent cough which has lasted 3 weeks or more. Whereas asthma is a condition that affects the airways, the small tubes that carry air in and out of the lungs. When a person with asthma comes into contact with something that irritates their airways, otherwise known as an asthma trigger, the muscles around the walls of the airways tighten. So this is your asthma definition.
So are there any tips for staying out of hospital then?
Well, there are many tips. Most people can avoid serious flare-ups over the winter by staying indoors on the worst days, keeping their rooms warm. Around 18 to 21 degrees Celsius is the recommended level, and making sure they use their inhalers when they need to. They can also monitor the Met Office website, which you can find on www.metoffice, that's all one word, .gov.uk, and I'm sure that can be accessed through the BRFM website too, as it gives warning of cold weather which can affect those with breathing problems. Some people risk getting worse because they don't want to bother their doctor, but GPs will always do their best to see patients who need to be seen urgently, or they will phone them back, which is also a very good service that can be tapped into should you wish to. It is important to remember that you don't have to be seen by just your doctor. All GPs in a practice will be able to see your medical notes if needed. So here are 10 top tips for coping with COPD that we've put together for you guys. So number 1, check the weather before going out. Older people should stay indoors as much as possible to keep warm, particularly this time of year. 2, ensure you carry your medication at all times, as cold air can make it harder to breathe. 3, use your rescue inhaler, the blue one, before going for a walk or doing any type of exercise. This opens up the lungs, making it easier to breathe. 4. Breathe through your nose instead of your mouth to warm the air. 5. Protect lungs by wearing a hood or scarf that covers your nose and mouth. Keep warm by wearing layers of clothing and warm night clothes during very cold weather. Also, by having your mouth or nose covered by a scarf, this moistens the air and helps to prevent chest infections. 6. Recommended temperature in the living room is 21 degrees Celsius. That's 21 degrees Celsius or 70 if you're looking at Fahrenheit, and 18 degrees Celsius, so that's 64 degrees Fahrenheit in the bedroom. 7. Keep your home well ventilated. Air quality is more important in winter as most of us spend more time indoors. Avoid sitting in a room with an open fire or a wood-burning stove. The smoke can irritate the lungs, and this has happened to a lot of people, and I know the wood-burning stoves are very popular these days. And also it's one of the cheaper methods for some people if that's what you've got in place to keep your house warm, but just to avoid that irritation on your lungs. 8. Try to stay as active as possible to generate heat. Get up, move around and try to do some exercise. 9. Eat a little but often, including your 5 a day fruit and vegetables. A large meal can make you more breathless. Drink plenty of liquids. 10. It is wise for patients with COPD or severe asthma to have the flu jab. Speak to your GP about standby antibiotics and steroids at home. Keep a spare up-to-date inhaler. So we've kind of tried to put those into small facts because I could go on and really elaborate on all of those, but they're just sort of simple tips to use as a guideline to follow. Obviously there's a lot more information out there if you want to go and find it.
Continuing to talk to Rebecca this evening, and I was wondering if you can tell us what happens if someone has a serious attack.
Well, if you have a serious attack and cannot breathe, obviously this is going to cause major panic, the feeling of suffocation. There's nothing like it really. The first step we would urge you to take is to call your GP. However, if it is in the evening or at the weekend, call NHS 111. That's the new system, the NHS 111. If you've not heard of the 111 service, all of your surgeries have the orange leaflets telling you all about this new service. The call is free from mobiles and landlines. If you are still having problems after using your inhaler, are unable to speak and your lips are turning blue, then obviously dial 999, and that's just really important to remember. And I'm sure you've all got common sense out there, and just don't hesitate in those kind of incidences to dial 999.
So what causes COPD then?
Well, COPD is one of the most common respiratory diseases in the UK. It usually affects people over 35, although most people are not diagnosed until they are in their 50s. An asthma attack can be triggered by extremes of temperature, a cold cigarette, smoke, stress, or an allergy to food like milk, eggs, fish and nuts. Fur and feathers of a family pet can also bring on an attack, but these just sort of if they're those individual irritants to that person. Everybody experiences asthma differently, but the main causes of COPD is smoking, and I'm sure that's no surprise to you listeners out there that smoking is the biggest cause. There is no known cure, although there are ways of making the condition more manageable. If you are a smoker, stopping is the single most effective way of reducing your risk of getting the condition. Obviously easier said than done. It is important COPD is diagnosed as early as possible so treatments can begin to try to slow down the deterioration of the lungs. Many people who develop symptoms of COPD do not get medical help because they often dismiss symptoms as a smoker's cough. COPD affects more men than women. So, sorry guys. Although rates in women are increasing, so, don't just think you've got away with that out there, ladies.
And we're now joined in the studio with a COPD sufferer, Pete. He's from Minster. And Pete, firstly, thank you very much for coming in to speak to us.
You're welcome, Daniel.
I was wondering if you could perhaps tell us how you actually found out you had the condition and what led up to you finding that out as well.
I think over a certain period, I started getting a bit breathless and stuff like that. And then I do a dusty job. I had a sash window company, so I stopped doing that as well because I was finding it was irritating me. So I went and worked on nights for Morrison's, and then where I was lifting things about, I was getting pains in my chest and stuff like that. And I found that I couldn't do the job anymore. So I went down and got tests from the nurse, and I think it was a peak flow test and stuff like that. And then they came up and told me that I had COPD, chronic bronchitis and asthma. So it's just one of those cards that's dealt to you and you've got to deal with, I suppose.
We're going to be talking to Steve and Julie. Firstly, thank you very much, the both of you, for coming along as part of our slot to tell us a little bit about what you do.
Thank you for having us.
So I was firstly hoping, you're the health trainers, and I was firstly hoping you could tell us a little bit about how you're currently looking after Pete and what exactly you do.
Well, we help people between the ages of 18 to 65 to change certain things within their health. It's a free service that's confidential and is provided by the NHS. It has like one-to-one sessions, and we're based on the island, all over the island, places like Castle Connections, Queenborough, Sheppey Leisure Centre and the Gateway, places like that. We run different groups within the leisure centre. One is called Move and Groove, which is on a Thursday at between 10 and 12, and this is for people that have disabilities, and they can go and pay £2 and they can play anything like table tennis, bowling, badminton, swimming, and that session goes on each week. It's a weekly thing.
At the moment we're talking to Julie and Steve. They're health trainers. They're telling us a little bit about what they do and what their job involves. And I think Steve is going to continue on telling us a little bit more about that.
Yeah. Well, I'll explain a little bit about the service and how we're qualified and things. There are 35 health trainers around East and West Kent, all qualified in the City and Guilds Level 3. And we work in, like I said before, in all sorts of areas. We can give advice on healthy eating and weight management, alcohol, drug issues, anything like that, debt, housing, even registering with a doctor or a GP. And one of the most important ones at the moment on the island is emotional well-being issues. We have a lot of clients that have underlying health problems, but they have emotional well-being issues as well, and we're finding that seems to be getting more and more, common. I'll let Julie explain about what she does on the island. I work within the Gateway, and I deal with a lot of weight management, and as has been said, I help people work out on the Minster Lees.
I do the Thursday walk. It's a health walk based on working at a much higher rate than the normal health walks that are on the island, because the idea is to increase cardiovascular fitness, which some of the basic health walks don't do if you're at a much higher level. I also work with Job Centre Plus, and I do weight management on the island as well.
And Steve, John was telling me that you appeared in the Sheerness Times Guardian, all relating to the machines that you work out on along the seafront. So I was hoping you could tell us a little bit more about that.
Well, on this island there isn't much choice for gyms, and a lot of my clients unfortunately are in that position where they can't afford a gym membership. So I tend to take clients down there, try and train them on the machines to make sure that they don't injure themselves, but also to make sure that they understand what each machine does and which muscle group it works. And actually, if you know how the machines work on the Lees, actually you can get quite a good workout. I have Peter here, who I trained on the Minster Lees, so he can probably tell you a little bit about how it feels to be one of my clients on the Lees.
Well, yeah, that'd be good, Peter. You could just come into the mic
keep
and
a straight face when you say that. Yeah, well, we had a wonderful time. It's we had a bit of fun on it. It was very difficult at times, but because Steve's such a good trainer, it was a good laugh as well. And I think that anyone that gets into this sort of situation with a COPD, especially my age now, getting old and fat, etc., I think you should get out and have a go at it, because never give up. And I really enjoyed it, and I found that after the training session on each of the weights, he sent me up and down the stairs, and I felt a little bit knackered, etc., and it was great. I felt better myself, and I found that since doing it for a little while, my breathing's got better. I can sing better. I can play my sax a little bit better. Not very well, but good. But the whole experience, I think more people should do it, because it is fun, and some of the trainers are absolutely brilliant. So that's how we really think we should play it, really.
Thank you for that, Peter.
You're very welcome.
Well, that's certainly good to hear what it's like from somebody who's had the experience of using them and then working with a trainer as well. So was there any sort of areas you wanted to cover, or were we going to move on to the contact details next?
Well, the contact details, I can give you the contact details. The free phone number is 0800 849 4000, and you pick option number 3. Or there's an email, which is kcht.healthtrainers@nhs.net, or a website, which is www.yours-services/health-trainers-kent/.
And Pete is someone who was diagnosed with COPD. We've been talking to him alongside the health trainers this evening, and I think you just wanted to add in how you found honey has helped you understand, is that right?
Yeah, indeed. I was drinking sort of 20 cups a day of tea with 3 sugars and everything else, and Steve told me off, and so I changed over to honey and put that in my tea, and I found that the local honey in my tea was really, really nice, as well as the fact that I wasn't having as much sugar. And I'm finding that I wasn't getting so much colds, and that's one of the things I've got to try and avoid. So eating your local honey is really, really good for you. Good fun for the kids to put in their cakes and everything else instead of sugar. So I think everybody should go to the local honey farm.
So, Steve, I was just wondering, before we finish off, if you could go over those useful contact details for our listeners.
Okay. Well, Rebecca has asked me to mention that the COPD information is in most of the doctor's surgeries on the island, and if you need any information, just go in and ask, and they will hopefully have a leaflet. For the health trainers, there's a free phone number, and that's 0800 849 4000, and then you pick option number 3. There's an email address, which is kcht.healthtrainers@nhs.net.
Well, I'd like to thank all of you for coming along this evening and covering all those areas for us.
Thank you.
Thank you.
Thank you very much.
So that is our regular slot with the Swale Clinical Commissioning Group for this time, and I've no doubt that John will bring in another selection of people in 6 weeks or so's time, where we'll be covering more subjects for our regular slot with the Swale Clinical Commissioning Group.